Dr. Oz, good morning to you. We heard very clearly last night all about the social distancing, and the numbers were scary. They said essentially it's working, but without social distancing and hand washing, 1.5 to 2.2 million people could die, according to the models. Best case scenario here in the United States, between 100,000 and about 250,000. Those are the kind of facts, when people hear it, they realize, wait a minute, I really can have a big part in this behavior of the country going forward.
Well, this is an era that will generate new leaders. If you're out there wondering what you can do, exactly that. Figure out what you can enact in your own life. How can you help others do what they need to do? Because there's no question, the federal government, state governments, they can't do this on their own. This is a battle that will be won in our homes. I think we've all recognized that for a while. The more data we collect about exactly how this is transmitted and what actually works when you try to sort of suffocate the virus, the more we realize that decisions you make, not just in your own home, but as you foray out to buy things and to eventually go back to work, will make a huge difference. So we're training our nation to be warriors of a different type. And I think what the president of the task force was saying last night, yes, it was somber, but it's the truth. And in medicine, you always tell people what's really going to happen. That way they trust you. And folks have an unbelievable ability to cope if they know what's coming at them. And that's, I think, what's happening this week in the United States.
If you look at the bottom of the screen, White House projects 100,000 plus deaths possible from COVID-19. Deaths right now, 4,000. We have a long way to go before we get to that number, and that's pretty scary, and that's what the president was talking about yesterday. Listen to this, Dr. Oz.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. When you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible.
Dr. Oz, what's your reaction?
100% agree with his estimates. I think that the tone is on target. Most of our governors are echoing the same reality. I say most, not all. I think one of the big messages we have to get out to other parts of the country is, once you've seen what's going on in New York, and all of us are here, so firsthand we're getting a glimpse of it, you recognize how bad this could be. I think the task force, and I'm interviewing Dr. Birx in a few hours, I think they're all unanimous in believing that we can stop what happened in New York from happening in other areas of the country. But those hotspots are still there. And now we at least know what the clues are. But here's why everyone says 2 weeks from now, we'll finally get a little bit of a breather. It's because in China, when they really cracked down aggressively in Wuhan, it took 24 days from the 20th of January to the 13th of February until they finally were able to get to the pinnacle, the top of their mortality rates and hospitalization rates. And then it came down pretty briskly. So that will give us 2 more weeks in New York of suffering. And it's been difficult. And again, you commend all the unbelievable people, doctors and nurses, but a lot of folks getting the supply chain right, middle-level managers stepping up and becoming the leaders that everyone knew they could be except them. And these battlefield commissions are changing the way we're living life. And it's working. It's painful, but it's working. We just have to make sure we expand that throughout the nation. Because Fox and Friends is a national show, people in places where that have not been that hard hit are going to hear this and wonder, is it coming to me? Could it happen? Absolutely. But it doesn't have to. You control your destiny. And that was the big message I took from the press conference last night.
I mean, I just can't believe 4,000 now, and that seems like stunning, and now they're thinking 100,000. But Dr. Oz, you're calling on Governor Cuomo to do what now?
Well, there are a couple of things Governor Cuomo has done exceedingly well, and those are examples for the rest of the country. Matilda's Law, and anyone who knows Matilda Cuomo understands why that's so important. And it's come into play again, obviously, because his brother got ill. There had been a visitation. But we want to make sure older Americans stay the heck out of Dodge. Do not risk going to see your relatives. I get asked this question all the time. It is imperative that we keep older folks separate, because as the rest of the country struggles, at least most of us will be okay, because the mortality rate is exceedingly low for folks under age 50. But when you get into the 70s, 80s, 90s, the rules change completely. But I am asking Governor Cuomo to reconsider an emergency measure he passed last week, right when we were trying to study some of these new drugs that are coming, that the FDA now has allowed doctors to prescribe for patients. Again, we don't have any randomized data on these drugs, but when you go to war, you march with the army you have. The governor has banned the ability of the average patient to get access to hydroxychloroquine, and I think we can do better than that. I trust the New Yorkers not to purchase and hoard the drugs. I think more and more this drug is pouring into the country. We should be able to get enough of it. Like other parts of the country, New Yorkers should be allowed to try the medication with the advice of their doctor because it's prescription. And it's a difficult decision I know he made probably to protect folks with autoimmune ailments like lupus and rheumatoid arthritis who are running short on the medication. But let's not fix it by banning its use. Let's fix it by getting more supply.
Well, as you mentioned, the governor's personal family has been touched by this. Here he is yesterday, midday, talking about he didn't see this virus coming.
Tired of being behind this virus. We've been behind this virus from day one. You don't win playing catch up. We have to get ahead of it. We underestimated this virus. It's more powerful, it's more dangerous than we expected.
You know, Dr. Oz, last night we heard from the president, and he said, you know, people could wear a scarf over their face when they're out and about in public. You know, not one of those N95s because those need to go to the healthcare providers. But the thinking is the CDC may actually change the ruling because there's these spreaders out there who don't have any symptoms and they're walking around. You know, they're in the grocery store or wherever, they could be spreading it. Whereas if they had a scarf or a cloth mask, it might not cause as much spread.
So, Steve, my show today is actually partly dedicated to this issue. It is a lot more complicated than it would seem, but here's where I'm coming down. I believe there is a role for face covering. I'm not even going to call it masks, because as you point out, we don't have enough masks of any type. So let those masks be used by first responders, by the healthcare system. But for the rest of us, if you're wandering around, going shopping, you should probably put something on your face if you think you infected and might be able to spread. Forget about COVID-19. It could be for any kind of infection. We used to look disdainfully at other cultures that did this routinely. Well, if you study the anatomy of a sneeze, which is, believe it or not, being done, and you actually look at what happens to these droplets, the big droplets might be the more dangerous ones. They're the ones that go into the front of your nose and infect you. It's not the small little droplets that go deep into your lungs, we think. It's the big ones. So if that's the case, wearing a cloth covering on your face may actually slow the bigger droplets from getting out of your mouth and going to somebody else. And I'll tell you what, it might actually be beneficial to protect you from somebody else as well. So we're going to revisit that whole issue of facial coverings. And you can make one simply right now out of tissue paper. You can make it out of a bandana. I'm going to show some craft shop examples. It's not difficult. And Ainsley for sure can do a better job than me. But this is stuff people can do in their homes and doesn't hurt anybody.
Dr. Oz, I'm glad you brought up the coughing and the sneezes because there's an MIT associate professor who researches coughs and sneezes and has been for years, and she warns that the droplets, the pathogen-bearing droplets of all sizes can travel, this is scary, 23 to 27 feet. It can contaminate surfaces and may stay suspended in the air for hours. Now, Dr. Fauci was asked about it, and he downplayed it. Listen to this.
What it was looking at the distance that droplets fly by speaking, by coughing, by sneezing. So if you go way back and go, achoo, and go like that, you might get 27 feet. But so when you see somebody do that, get out of the way. I'm sorry, but I was disturbed by that report because that's misleading. That means that all of a sudden the 6-foot thing doesn't work. That is a very, very robust, vigorous achoo sneeze. That's what that is. And that's not what we're talking about.
So, Dr. Oz, he said that's the extreme. What do you say?
He's 100% right. You know, if you have one of those rolling thunder sneezes and you're so inconsiderate you don't block your sneeze yourself, shame on you. Yeah, you could probably do it. I mean, sneezes travel about 90 miles an hour, Ainsley, so you're not getting out of the way of it anyway. The best thing someone can do to help you is to sneeze in a different direction. But if it goes right at you, it's going to go, it could go 25 feet. The reality is those 6 feet measures are designed for a different purpose. They're designed for talking. And it's the talking that actually allows enough spit and virus particle to come out of your mouth without you realizing it, that you could quite easily contaminate someone in your workplace. That's why the definition of a close contact is closer than 6 feet for more than 10 to 15 minutes. It's not an accident. So yes, sneezes and coughs, it'll go further. That's why masks may play an important role. And I highlighted something a bit earlier. I'm going to reemphasize it. It's the size of the droplet that matters. Bigger droplets don't go as far, but they are the virus-carrying droplets that might go right into the front of your nose, where we believe a lot of these infections happen. That's why swabbing the front of your nose may be a reasonable way of screening. You don't have to go all the way to the back of the throat, as the president had acknowledged was uncomfortable. So masks make sense, especially with sneezes. I'd rather you use facial coverings that are not made of any kind of material that a physician or nurse may use. But this may change their culture. You know how we basically have gotten rid of handshakes? It's going to be a long time, folks, before you put that hand out there and firmly grasp someone. Because you know that a handshake is probably 10 times more virus transmission than an elbow bump or a fist bump. Well, it turns out that using facial coverage may protect you against this whole argument of how big these droplets are and how far they go. No one cares if you're putting some protection on during these periods of self-isolation, of self-distances.
Well, the most disturbing thing you've said so far is they're doing limited studies with hydroxychloroquine, because we heard they were going to start doing it a lot in New York. So they're still having some problems with it. But I want to bring you to the Texas hospital. Yesterday, they treated a COVID-19 patient with survivor's plasma, like they did with Ebola. So this is one key. So if I prove that I have the immunity, use my plasma to help someone who might not yet or get better quickly. How interested are you in that study?
Super interested. There was a big piece in JAMA, which is one of our most prestigious journals, showing that 5 people deathly ill in the ICU, 4 recovered nicely, 1 was still alive. So just those numbers alone caught my attention. The Texas hospital, I know their protocols. We have it examining as well at New York Presbyterian and other New York City hospitals to do. It's called convalescent plasma. I'll tell you what we need. We need folks to donate blood if they've been sick. That's what's going to hold us back. So if you've survived COVID-19, and as you point out, we're going to have a lot more survivors, a ton more survivors than people who pass from this illness. You're going to have antibodies in your blood that help you beat back the virus. People who are mortally ill don't have those antibodies at the same level. We can jumpstart their system. It's like, you know, giving someone a couple of cables with your battery and allow them to get their car back up again. That's what you're basically doing. So blood banks, the Red Cross, they're looking for convalescent plasma from people who've recovered. We're going to take those immunoglobulins and put them in the patients who are in ICUs and respirators who are getting worse. I have high hopes for it, not just because that'll work, but it'll teach us a lot more about how you can pull people back from the abyss, the darkness of death when they're ill with COVID-19.
Perhaps another note of optimism. All right, Dr. Oz, thank you very much. We'll see you back here tomorrow, same time, same channel.
Thank you.
All right.